This is Susan Piri. She is a trained community health worker. She provides basic health services and health education to her community. She is very dedicated to her job and to helping her community. This is another community health worker, Francis Mumba. He too feels motivated to volunteer and provide health services to his community. Together, and along with other community health workers, they form a vital bridge between the community and the nearest health clinic or hospital. The value of community health worker programs is undeniable, but there must be effective management of these programs in order to positively impact health outcomes. Community health workers, or CHWs for short, provide a range of community health services, such as health education, identification of illness, provision of basic treatment, vaccinations in the community, patient referral to nearby clinics and hospitals for more acute health care. Francis Mumba also serves as a leader of his community health worker group and leads by example. Francis's job as a CHW is to help the community with treatment of minor illnesses and to mobilize people around health issues. He makes sure pregnant mothers receive health services on time. He also treats children, especially those who are malnourished. Susan Piri has been a CHW since 2007. She has been trained to provide mothers with crucial information to raise healthy babies.
Tufuna alute msanga chifukwa chakuti akaluta na 4 weeks kapena 8 weeks pala tiziwe kuti mzimayi uyu tambira naye pamozi olo kuti ni mzimayi ali positive chipatala chuziwa mochitira kuti ula munthu mwana asatoleko matenda ya.
When starting and managing a CHW program, it is very important the community is actively engaged and feels a sense of ownership over the program. This increases community buy-in and program support. Involve the community in the CHW selection process. Community members can be very good at identifying strong candidates who are influencers, respected and trusted by the people. Candidates can be nominated by the community or can be volunteers. The community can continue to participate in the CHW program through monthly health committee meetings that can help the clinic identify what support the community would like to see CHWs provide, what health issues need to be addressed, and arrange for the CHWs to meet community groups and provide health education. Community engagement also increases community health worker retention, motivation, performance, accountability, and success.
Collecting ideas from the community helps in having a bottom-up approach set up, and this in turn tends to improve community participation.
Selection criteria for CHW candidates will depend on the needs of the community. Some criteria to consider are educational level, time spent living in the community, how engaged the person is in the community, record of volunteering, gender, and the personal attributes or characteristics. Susan was chosen by her community because they trust her and because she met the selection criteria.
Muno community ni usebenzera mona kwanisha 11 years. Na kwanisha 11 years nisebenzera muno community ndipo nilina bana 10 amuna 5 wakazi 5. Cheni tuntha kweni kwenze kwiwera NGO kwazyaye so yo NGO enzofuna bantu ozibako kubelenga so enze kamba munzi uli wonse utumije bantu so bantu pano pamunze chizosankhane so peni lutakula kuyamba kuphunzira panchito za umoyo yala NGO posira nebe ntumija kuminga kula benilandira first ben trainer za adherence ngemwene ngenera umukutilomba yambe.
CHWs should be paid for their work with a stipend. Recognizing the value is important. They should not just be treated as volunteers. When treated well and are motivated, they will go way above and beyond the basic job requirements and will be easier to retain in the long run. Resources to support community health worker programs can sometimes be limited. Look for innovative solutions. Teach community health workers entrepreneurial skills. Encourage them to form small businesses by furnishing starter money or provide resources like access to health facility land to grow crops. Consider incentives or recognition for top performers.
Tufunika kuti choyambirira tikaliyo chitavonse neo niitane amdala tinkhale pansi na bana yamene yatuchita yoendera bantu kuchita tyani so naphunziramo zambiri so nuona kuti ni programu ya bwino ngako yakuti olo kuti nileke chunikanga.
Francis also gained some entrepreneur skills and knowledge that helped him and his family. In healthcare, things are continually changing. There are new diseases, new treatments, and better improved ways to do things. Training or continuing education should be provided regularly and should include updates on health topics that may be directly impacting the community. CHWs are on the front line and may often recognize that there is a health problem before the health facility is even aware. Listen to what CHWs have to share and find ways to continue to provide information about issues that concern the community.
In some communities, we've actually been able to tell that they lag behind in terms of sanitation because the reports that come through and through from a certain neighborhood shows that such a community needs the services of a community health worker in relation to water and sanitation.
Susan continues to gain the trust of the community. She teaches them about breastfeeding, hygiene, adherence support, disease prevention, and nutrition so that mothers know how to prepare healthy food for their families. Supervisors should establish regular monthly meetings. Not only give input, but also to provide support. On occasion, supervisors should accompany CHWs in the field so that they can observe the CHWs at work, interact with community members in order to advise on ways to strengthen the education, counseling, or interaction.
As a CHW supervisor, my roles include receiving reports from the community health workers, providing technical support and supervision to the community health workers.
Supervisors can use a task checklist or assessment form for tracking CHW's progress. Review of CHWs should be based on knowledge and skills, such as health support, the number of patient visits, household assessments completed, community education conducted, and other program-specific targets. How much the management team invests in its human resources and how well it uses those resources will have a direct impact on the success of a CHW program. This means engaging the community, selecting qualified CHWs, providing adequate training and tools for CHWs to do their job, effective monitoring and supervision to motivate, recognize, and encourage their team, understanding overall performance and needs of CHWs, and knowing what impact the CHWs have on the community. But most importantly, a successful, well-managed CHW program in your community will save more lives, create a healthier population, and ensure the well-being of all.